the evolving technology, imaging has become very essential in daily medical practice and diagnosis. With the help of this short video, I would like to decode the orbital lesions, a step-by-step computed tomography interpretation guide. When we see a lesion on CT, these are the following steps which we should keep in mind. Let's start. First, we should know the tissue of origin if it is arising from normal structures such as optic nerve, lacrimal gland, or extraocular muscle. Next is to know the location. As we know, the important surgical spaces are the extracorneal and intracorneal space. So the blue one depicts the intracorneal space, which is within the extraocular muscles. So now let's see these three lesions. These are all located within the extraocular muscles. So this is the intracorneal space lesions. Next is the extracorneal space, which is located outside the extraocular muscles as depicted in purple color. Now let's see few lesions. So the first and second lesions, we see that these are located outside the extraocular muscle. So these are extracorneal space lesions, as well as in these two images. Some lesions can involve both intracorneal as well as extracorneal space, as seen in these three images. Next is to know at which level of orbit the lesion is located. Anterior to the equator is the anterior orbit. Posterior to the equator and till the midpoint of optic nerve is the mid-orbit. And anything posterior to the midpoint of optic nerve till the optic orbital apex is the posterior orbit. Next is to know the size and shape. Benign lesions are usually well defined and have a regular shape, and they can be measured at their horizontal and vertical dimension as seen in the first and second image. The same as seen here in the first image, we see a well-defined lesion in the lateral part of the orbit, which can be measured easily. While any infiltrating or malignant lesions have irregular shape and irregular borders. Now let's see the internal characteristics. In the first image, we see a well-defined lesion located in the intracorneal space at the level of mid and posterior orbit, which is homogeneous. While in the second image, we see a well-defined lesion, but it is heterogeneous, where we see a hyperdense lesion at the center. So we call it heterogeneous. In the third image, we see an irregular lesion involving both intracorneal and extracorneal space with two hyperdense lesions suggestive of phleboliths. So this is a heterogeneous lesion. Next is to know if it is taking up the contrast. So here in the first image, we see a pre-contrast image, and post-contrast, we see that this lesion is taking up the contrast, suggestive of a vascular lesion. Next is to know this effect on their adjacent structures. A long-standing benign lesion can cause bony fossa formation as seen here, while a malignant lesion can cause a bony defect. And this fossa formation can be seen very well in this third image. Next is also to know the effect on the globe. All these three images show globe indentation. In the third image, we see that the globe is in V shape. This indicates increased intraorbital pressure. Here I would like to highlight the red flag signs which we should keep in mind to know if the lesion is turning malignant, if there are irregular margins, and if the lesion has suddenly increased in size and involving the adjacent normal structures, causing bony erosions or bony defects, and spreading into the adjacent structures such as sinus or intracranial. Here, for example, we have an elderly male who presented with inferotemporal lesion, which is pushing the globe medially. On imaging, we see that there is a ill-defined lesion, which is homogeneous, involving both extracorneal as well as intracorneal space. To know its extent, on axial scan, we can see that this lesion is involving the mid-orbit as well, molding around the globe. So it's suggestive of a lymphoma. Here, I would like to leave with a food for thought question. So here we have an image showing right eye proptosis, and two hyperdense lesion on the sclera. Can you guess what it is? Thank you.